always got to think, when I first was learning stuff at the vet clinic, I was basically told some of the pieces of material that you're working with, you gotta think of them as being like a bomb, and you wanna touch them as little as possible. The other thing is that stuff is dripping with acid, or you're dripping with acid, or a combination of the two, to try to get through your brain that there's certain parts that you cannot touch, because as soon as you touch them, you've contaminated them with your acid, and then they're dead. So, that's the way that I always thought of it, in order to kind of help me to make sure that I wasn't touching stuff I shouldn't touch, because when it comes down to it, when you have a sterile field and you have sterile instruments, you have a sterile doctor, you've got an animal that's open up on the table, and you can look inside and, oh wow, there's the small intestine, oh wow, there's the bladder. You know, you are looking at their insides actually. If you get bacteria in there, what's gonna happen? Infection, and if they get a really bad infection, what could happen? Absolutely. So, and you can tell if some of these instruments are not sterilized properly, you can tell in post-surgical care. Surgery will go great, the animal will do awesome. About a day or two later, they'll start to have fever. And I've seen it happen, and it sucks. You can, as long as you stay on top of it, treat with antibiotics, and usually it's okay, because it's just because things didn't reach quite the proper temperature. But if it were to be really bad and you were to have unsterilized equipment, you could have an animal in a whole lot of trouble, a whole lot of hurt. Because have you guys talked about some of the bacteria that actually lives on us? Do I have any Grey's Anatomy fans out here? No? Oh, come on, that's like one of the best examples. One of the doctors is really involved, and this is obviously fake, but we have tons and tons of bacteria on us all the time. You think about what we touch outside, inside, animals, people, pets, we sneeze, we cough, we're disgusting creatures. The skin is a great barrier to keep all that stuff out of our system. But our skin is covered in bacteria. We are literally just crawling with it, yeah. As Mrs. Bakken looks herself in the corner. That's why we need to protect the patient from us and make sure that we are properly covered. And we can wash our hands, but it's not good enough. That's why we have all these different tools, and if you've seen in some of the surgical shows, usually they'll have the sinks set up that have the really big tubs. They've got the really big things that'll come up in the air, and they've got the foot pedals in order to scrub. They've got the special soap that they scrub with, which is typically an iodine or a chlorhexidine-based scrub. We have the same thing at the clinic. It's all to try to keep everything as clean and disinfected as possible. So we will have our doctor, we don't have the foot pedal at the clinic, but we've got very high sinks that have very long handly thingamabobbers, whatever they're called, so that she can use her arm to turn it on and turn it off, so that she's not touching anything with her hands. And she'll go through and she'll scrub for a certain amount of time. She'll use a special scrub to do it, and then she'll actually have opened up next to her a towel that has been sanitized. It's been autoclaved, so that means that it's reached a certain temperature using steam to get it hot enough to kill off all the bacteria. She only uses that towel to dry her hands, and then she's ready to start putting on gloves and stuff like that. But it's very, very serious. You don't do it right, or if you mess up with the instruments, you're taking somebody's life in your hands, really definitely. These are a couple indicators that we have with our materials to try to help to make sure that we know stuff has reached the right temperature. This tape is the same tape that we have on here, and it's the same tape that we have on here. What's the difference between this tape and this tape?
That one has lines on it.
Exactly. If you want to pass this around, you can see where the lines would be on it. What do you think those lines mean?
It's where, it's like when it turns colors, it's sterile.
Yeah, it's reached the proper temperature. Anybody know what that temperature is? Have you guys talked about that?
Oh, I should know this, but I don't.
You should know it, especially if you're going to do anything with competition. You should know a proper temperature for it to reach to make sure that it's sterilized. And I'm not comfortable saying it because I don't know the exact temperature, and I don't want what I say to stick in your head and have it be wrong. I have an idea as to what it is, but I'm not comfortable. I don't want to have you stuck with the wrong temp in your head. I think Mrs. Bakken is all over that. But yeah, we've got indicator there right outside before you even go into any of your surgical instruments, before you go into anything. The other thing that we have here, you can see as we pass these guys around, each one of the packs, each one of the drapes, each one of the gowns, each one of everything is gonna have a little, simple little guy in there that looks like this. When that's sterilized, what do you think happens?
Decay and arrow match and will be black.
Yep, everything's gonna match, and you can pass it around so other folks can see. It's just another thing that we have in there to make sure that we're reaching that proper temperature. And the time where we had an incident with our autoclave probably about right before I came teaching. The autoclave, something had happened or it wasn't up to snuff or something where it wasn't black. It was brown, it was a dark brown, but it wasn't quite as deep as what we needed it to be. We did 2 surgical spays, and we were very cautious and very aware and calling those people to make sure, and we told them that we sterilized the equipment, but there is a question. Sure enough, they came back to the clinic 2 days later. They had infections. They weren't super, super bad. We put them on antibiotics and they were totally fine. But it was just a little bit off and bam. So more things that we have to make sure that we're keeping our people safe. So you can bet, what do you think is inside of this? Gown with one of those guys. We've got a surgical gown that I'm going to show you guys how to open, and I've got a pack that I'm going to show you guys how to open, and then I'm going to show you how to wrap the pack as well. And this is stuff that you guys can practice. All you need to have is basically 2 square pieces of material that are good size, and you guys can practice wrapping packs at home or here in class or whatever. It's not that hard once you kind of get that mindset together. Yeah. Start with that. Well, you guys need to do the glove thing, the pack thing, the gown thing, and then rewrap the pack thing. Okay. Something else, and this is just, I'll pass this around for you guys to take a look at. You'll notice that these are needles, this is a syringe, this is another butterfly catheter, and this is suture material. When the person who is getting sterile is sterile, they can't touch any of this stuff, because what's all on the outside of this? Germs, right? I mean, you could lick this. I wouldn't recommend it, but you could, because it's not going to affect it for surgery, because there's already kinds of contaminants and that on it. Every single thing that you see here, including this guy, for opening and for opening these guys, there's certain ways that you open them so that you can maintain sterility. And like here, you'll have a person who is non-sterilized peel this back, and then when this is opened up, they'll just literally dump it on there for the doctor to grab. Same thing with shots. All shots are going to have where you've got the tab so that you can peel it open and just drop it onto your sterile surgical field so that we're not contaminating it. Same thing with the needles, same thing with the butterfly catheter. Pass it around, take a look. If you guys do open these, if you pull them past the point, that's fine. I already double checked with the doc, and it's okay for these to be trashed. And the same thing with this. It's got a special little place where you open it up.
Wait, it's a bag inside of the bag?
Everything that we do at the clinic, we do double sterilization technique.
Okay, I understand.
Yep. Seems kind of, but it's just another way to make sure that everything is protected. So you have 2 layers of protection, and plus you have that much more when you're opening it up to try to make sure that you're not contaminating. That's the latest recommendations, is to actually, we used to only wrap these once, we used to only do those once, but we started changing our protocol probably about 3-4 years ago. So it hasn't been that long.
So I seem to be finding 30 minutes at 250.
I thought it was 270.
Well, and I found some 270s too.
Okay.
250 to 270.
Yeah, I would say 270. When in doubt and there's a choice, I'd probably go to 270. That's the number that sticks in my head.
Yeah.
And just like Mrs. Bakken says, it needs to be for a certain time period. Oh boy. So, once you got the doc is all, she's doing her thing, usually you have the assistant open up the rest of her stuff. She does her thing for sterilization. One of the things that you have to do as the assistant is you have to be able to open up a pack. Your pack is gonna have your sterilization tape on there, and it lets you know, it's gonna have information on there. It's gonna tell you what's in here, because without looking at that, I have no clue what's in here. Something shiny, that's all I know. And there's gonna be certain procedures that need certain surgical instruments. You gotta know what you're getting into. This also tells me AB, So one of my coworkers is the one who sterilized this, that way if there's a problem in there, we can come back and we can knock her on the head a couple times and say, Amanda, you messed up. The last thing that's on here is gonna be the date. Things that are sterilized are only good for so long, and then they need to be re-sterilized. Don't ask me what the time frame is on it, because I don't know, and I don't wanna tell you wrong. So, I'm the assistant, I'm gonna open this bad boy up. Remember, I'm covered in acid, and this is covered in acid. If you were to have acid dripping off of me, I'm dripping, so I can't be draping myself over this thing, right? I'm gonna get it covered in my germs and yuckiness. So when we do this, right now, everything is contaminated on the outside. Take the tape off. Oh my gosh, there's a lot of tape. And you wanna always start, kind of the worst pass that you have is the pass that you're going away from yourself, because I'm having to put part of me over the pack, right? That's the worst pass possible, because as I'm dripping acid, I'm dripping on there a little bit. That sucks. The good thing about it is, I've got several protective layers underneath here to make sure that I don't have anything go further than that. So the first one, and you guys can see well enough, I think you can.
So you're what, just emphasize. You're saying that it's really important how you start, like how you position everything before you start.
Yes, absolutely. And you'll notice that it,
Because if you did it that way, then all of a sudden you're like, oh, I just kind of did this backwards.
right, you wanna make sure that the tab that's sticking out, this little guy, is towards you. You wanna have it towards you so that it's easy to pull open, and we'll pass it around and show you why. So you just pull it out, and then I kinda will keep my arm to the side and bring it over. And you wanna bring it all the way over so it's laying as open as possible right now. And that's as open as I can get without contaminating it more. Because the beauty of this, once we open this up, we're gonna have a nice sterile field. This whole 3x3 or whatever it is, it's gonna be nice and sterile, which is awesome, because then I can dump stuff on it, I can do whatever I need that's sterile for the doctor. You'll see everything is kind of tabbed. I can go ahead.
Stand up. You need to stand up and see it.
Pull it over. Pull it over. And then now,
Notice you use left hand, right hand.
I'm making sure I'm not dripping over this bad boy. I don't want to get it covered with stuff. And then there's one more little tabby here. I'm just going to pull open like that. Seems not hard, but a lot of people will mess it up because they get over the top of it, and you will be dinged on it, both in the veterinary professional field and in competition, because I've seen it happen in competition. And then, actually my job would be done, because everything that's up here is sterile. So the doctor is the one who would go through with her sterile gloves on and her sterile gown. She would open up the next layer, okay? Do you want to go on to the next layer, or do you want to look at the gown and the gloves to know what she would look like, or how do you want to do this order-wise, guys?
Doesn't matter.
It doesn't matter.
When she continues, she would be obviously on the other side the doc would be. Again, she'd be all completely sterilized, good to go. She's gonna use the same technique that I did though. She's gonna be on this side towards the flap. She's gonna open it, open it, open it. And then we have our goodies inside. This is sterile. And then she can root around and get whatever she needs in there. You will see that there's a sterilization strip in there as well. This sterilization strip has okay. That means we're good to go. We're ready to rock for surgery. It also has surgical instruments in here, which you guys for identification would be good. It also has sterile gauze in here ready to go for her for surgery. So, well, yeah. If you guys want, you guys can pass it around, take a look at it.